Now, I call upon the next speaker, Dr. Anagha, and she's going to be talking about patient testimonials, PC-IOLs, 4-in-1 multi-cert loaded injector system.
A very good afternoon to all of you. Very good afternoon to all of you. So, I would be sharing my experience with these lenses. So, first of all, I would like to say that these are the lenses that I've used, around 16 lenses so far. And if you can see the ones that are highlighted out of these, there are around 5 that are torics and 4 patients who have a combination of geometric in one eye and geometric plus in the other eye. I'd like you to see the last 3 columns, the distance vision, the near, and the intermediate for all of these patients. And I was pleasantly surprised and very, very happy to see that all of these had a 6.6 N6 in all of these distances. So these were some of my surgical experiences also. We have used these monofocal Vivinex lenses for the last so many years, and with uh, very, very great smoothness and with ease with which it actually opens up into the eye. The consistency with which it really, each of these lenses, whether it's a high dioptric power or a low dioptric power, and the kind of optical clarity it gives is absolutely amazing. So this was the patient post-op, and this was, can we have the sound please? That's why I'd asked for the sound.
माझ्या दोन्ही डोळ्यांचं ऑपरेशन झालं. 8 दिवसाच्या फरकाने माझं ऑपरेशन झालं आणि ऑपरेशन अतिशय सक्सेसफुल झालेलं आहे. आणि मुख्य म्हणजे हे ऑपरेशन रोबोटिक इम्पोर्टेड मल्टीफोकल लेन्स माझ्या डोळ्यामध्ये बसवलेलं आहे आणि त्याचा मला अतिशय फायदा झालेला आहे. मला अगदी बारीकातलं बारीकसुद्धा सुंदर प्रकारे वाचू शकते मी. नंतर सगळ्या प्रकारचं काम करू शकते आणि हे ऑपरेशन होताना मला कोणत्याही प्रकारचा त्रास झाला नाही. आताही मी एकदम ओके आहे. आणि इथे असलेलं इथला स्टाफ, मॅडम, या सगळ्यांचंच अतिशय सुंदर प्रकारे कोऑपरेशन इथे आम्हाला झालेलं आहे. तुम्हाला असं वाटत असेल तर तुम्हाला बारीकातलं बारीकसुद्धा मी वाचू शकते. भोपाळ, नागपूर, आसाम, जयपूर, बिहार, लाईट मोबाईलवर सुद्धा काम करू शकते. आणि तुम्ही कोणालाही ऑपरेशन म्हणजे मल्टीफोकल लेन्सचं तुम्हाला खूप फायद्याचं ठरेल. जे तुम्ही असं काम करता, कॉम्प्युटरवरती काम करता, ऑफिसमध्ये जाऊन बारीक काम करायचं असेल तर त्यांच्यासाठी मल्टीफोकल लेन्स बसवायला काहीच हरकत नाही. मला तरी खूप फायदा झालेला आहे या मल्टीफोकल.
So they say the proof of the pudding lies in eating it, and then definitely these patients were extremely happy. Now this patient, where we used a femto technology and a geometric plus with toric, was actually a local corporator, a local politician, where definitely you all know how the demands are very high, and we have to be absolutely bang on, not only with the biometry, with the surgical technique, as well as with the results. And definitely counseling in all these patients become extremely important. So here we were fine with the surgery, we were fine with the lens. So let's see what he had to say. Can we have the sound please?
ऑपरेशन खूप छान झाला. कारण काल मला काहीच दिसत नव्हतं. आज सर्व काही मला क्लिअर दिसतोय. आणि भोपाळ, नागपूर, आसाम.
So this was another patient where the pupil was slightly on the lower side and the patient was a case of IFIS. So we decided not to take a chance, and along with the geometric that we had planned, we also decided to use a BX so that we don't have a problem on table. And then this was post-op. The rest of the surgery was as routine. This was a geometric with a toric. And this was the patient.
मल्टीफोकल लेन्सेस आहेत ज्याच्यामध्ये तुम्हाला जवळचं पण दिसू शकतं आणि लांबचं पण दिसू शकतं. तुम्हाला मग चष्मा वापरायची आवश्यकता नाही. जिथे तुमच्या डोळ्याची संपूर्ण इक्विपमेंटल चाचणी होते ती केली. जिथे तुम्हाला ह्या लेन्सची सुटेबिलिटी पण समजते. तुम्ही मल्टीफोकल लेन्स तुम्हाला वापरायचा आहे का, तो सूट होईल की नाही. तर त्याच्यामध्ये मला सांगण्यासारखी गोष्ट अशी वाटते की एवढी ॲडव्हान्स
Just goes to say how patients actually understand the kind of testing that we do preoperatively. They understand what a multifocal means. So counseling is really very important in these patients.
याची मला वाटतं आपण याला वर्ल्ड क्लास टेक्नॉलॉजी म्हणू शकतो. अशा पद्धतीचं हे इथे या हॉस्पिटलमधली अवेलेबिलिटी. इथला एक्सपर्ट. हा हे बघा, हे एकदम एकदम छोटं जे आहे हे नंबर 6 ओरिसा, पंजाब, बिहार, आसाम.
This was another patient where the astigmatism was around 0.75, and otherwise we would have planned to use T2 for this patient, but the patient was not affording. So we went ahead and did a femto-relaxing incision, as you can see here. Rest of the surgery was the same. So this was the femto-relaxing incision also. And this was the patient.
आणि मला भारीतले मी लेन्स घातले कारण मला चष्मा नको होतं. त्या घातल्यामुळे मला एकदम स्पष्ट दिसायला लागलं. घरी टीव्ही म्हणा, मोबाईल म्हणा, घरचे कामं करताना म्हणा आणि वाचन करताना म्हणा खूप मला स्पष्ट दिसायला लागलं. हे तुम्हाला मी वाचून दाखवते.
This was actually N5 on second day poster.
असल्या तरी त्या आपल्या भोवतीचे जग सुंदर करतात आणि आपल्याला ह्या म्हणजे मला बारीकले बारीक अक्षर मला वाचायला यायला लागलं, एकदम स्पष्ट दिसायला लागलं.
मला चष्मा नको होता.
And this was a police inspector who was there in our area.
विनंती केली आणि म्हणून त्याप्रमाणे त्यांनी माझं मल्टीफोकल ॲडमिशन ऑपरेशन करण्याची मला विचारलं आणि मी संमतानंतर मी बाहेर आलो आणि मला चष्मा दिला. म्हणे जा, कुठल्याही प्रकारचं डोळ्यावर काही बँडेज नाही, काही नाही, नॉर्मल चष्म्याप्रमाणे मी बाहेर आलो आणि मला दिसायला लागलं. मला इकडे तिकडे पण विचारलं की तुम्ही ऑपरेशन केलं का काय केलं. असे बारीक चांगल्या प्रकारे वाचू शकतो. आज तर दुसराच दिवस आहे आणि त्यामुळे मला खूप आनंद झाला आहे. माझं ऑपरेशन अतिशय सक्सेसफुल झालेलं आहे. ते अक्षर अतिशय बारीक आहे, परंतु मी चष्मा न लावता जो चष्मा समोर लावलेला आहे तो 0 नंबरचा आहे हॉस्पिटलचा. डिअर सर, दिस हॅज रेफरन्स टू द व्हिजिट ऑफ द अंडर साइन ॲट युअर हॉस्पिटल प्रिमाइस. मी आता कॉम्प्युटरवर देखील ट्राय करून पाहिला की मला पेपर तर वाचता येतो पण कॉम्प्युटरवर वाचता येत नाही आणि म्हणून मी कॉम्प्युटर इथे ऑन आहे माझ्या समोर आणि त्याचे अक्षर जे चांगलं दिसतं. पहिल्या याच्यामध्ये वेटिंग पेशंट.
So friends, the proof of the pudding lies in eating it. We were happy that our patients did well, and obviously the consent has been taken of all these patients before we are presented to you here. Careful preoperative selection of the patients, a precise surgical technique, good counseling of these patients definitely goes a very long way in getting greater success for these patients. We have finally happy surgeons and happy patients. We are already used to the great technological advancements in the preloaded technology that we have today with these trifocals, the continuous range of vision over the distance, intermediate and the near that these lenses have provided us, and the crispness in the near vision specifically with all these lenses. Thank you so much for your kind attention.
Thank you, Dr. Anagha, for that very nice presentation. I think these set of videos were as much, and please stay there, as much an advertisement for Anil Eye Hospital as for the lens per se. But what I noticed was that all these lenses, all these patients were essentially giving a testimonial for looking at different distances, distance, near and intermediate, etc. They seem to be very happy with it.
Yes,
but
sir,
we are more concerned about the quality of vision. I mean, I didn't hear any of them talking about whether they experience any dysphotopsia, glare, halos.
So they didn't, and they didn't have any dysphotopsia. They didn't complain.
You have obviously used all the multifocals, trifocals. Do you think, I mean, what is the extra that this lens, this combination brings onto the table?
Sir, even in all our other patients, the percentage of patients having dysphotopsia is not greater than say 10-15%. All of these patients were very happy with the quality of vision also. The ease with which they could read. If that lady, if you could see, she was reading N5. So the ease with which she could read made her very happy. The question of dysphotopsia may come probably later on, but as of now, none of these patients have complained of any glare or halos or poor quality of vision. They were happy that they were able to read. The basic criteria of all these patients was that they wanted to read without glasses. Simple. And that was what they got. And that made them happy. So I think the intent and the aim of giving them independence from glasses, even though they were counseled beforehand that they could probably, like we do for all multifocals. So they achieved and they got what they wanted, and that made them happy. And that was what I thought we should share. Also, how we select these patients, if you saw why I put in all these patients were that patients also understand the kind of workup that you do for them, that it is something more than a routine lens. That lady who was saying that she had to go through so many tests, even though they have to pay for it, they understand that there are special tests and special workups that are being done. So I think that is very important that they are counseled and they go through all of this so that they understand that we have done something better for them.
Yeah, Anagha, yes, it's a good presentation, but since, I mean, you also have your limitations because you have only used and there's no long follow. But then if like Ramu says, if you really want that, now what was that extra that using a combination of geometric and geometric plus gave, that doesn't, obviously you don't expect it to come out from their, their these reviews, because it's basically based on, the reading for near and distance. Probably it would come out of maybe, because they're all fresh post-ops. After that, when you are out in the field, and then maybe after a month or two, you do the test and find out the contrast and find out exact distance at which that probably it will
Definitely,
come.
sir. These are all early results. I'm not saying that we have got these lenses only in the last
I
few
no,
weeks.
fully know
So
that. Yeah.
definitely, see, I'm just sharing what we got, the results that we got as of now.
That means it proves that these are really good lenses as far as giving good vision at different distances.
Yes.
Was there any reason for you to choose a combination of these in the
Definitely,
patients
sir,
where you?
because the geometric and geometric plus, as we saw in the earlier talks also, the geometric plus gives you a greater light distribution for near, the 39% compared to the geometric plane. So if we use a combination, then the clarity for near, because the light distribution is better, is more, and the patients can read more easily.
But that when you checked uniocularly, did you could
So
demonstrate
these
that?
were all binocular patients.
No.
Uh,
Yeah, like in the eye where there was only geometry, did you see something that was less than when it was in a
Sir,
combination?
we did not want to tell the patient
Okay.
that because we don't want to instill in their minds that there is something different between the two eyes.
Thank you,
Thank you.
Dr.